The dental e-content for April 2026 is on film imaging. Dr. Swathi, Senior Lecturer, Department of Oral Medicine and Radiology, SRM Dental College, Ramapuram, presenting you this dental e-content for the business. The outline of this e-content will cover the basic composition of an X-ray film, types of intraoral X-ray film, intensifying screen, latent image formation, processing solutions, darkroom equipment, manual processing, rapid processing chemicals, automatic film processing, the characteristics of an image, what is an ideal image of diagnostic quality, and a note about faulty radiographs. So this is a schematic picture to show the composition of X-ray film. As you can see, the X-ray film has a waterproof outer package and contains a black paper. The film is placed inside. And again, the film is encased by black paper on both the outer and inner side. And we have a lead foil backing. The inner side of the film, this is the visual representation. Again, to show the composition of X-ray film, it has a protective coating of gelatin. Emulsion, silver halide crystals, and we have the adhesive layer. A flexible base material made of polyester polyethylene terephthalate. It provides mechanical support to the emulsion. And again, a layer of adhesive, the emulsion, and protective coating, the gelatin layer. So what are the different types of intraoral films? So these are the three categories of intraoral films. The first one is a periapical or an intraoral periapical radiograph, which shows the teeth and the surrounding or the supporting periapical region and surrounding supporting structures, which is the periodontium, which includes the lamina dura, that is the alveolar bone proper, general cancellous bone as such, the period space, the periodontal ligament fibers, where the period space is seen. So this is an IOPA. So basic indication for an intraoral periapical film will be for imaging any dental caries lesion to see whether the dental caries is extending into the pulp and the periapical with periradicular tissues. Any kind of restorative treatment or root canal treatment. The basic baseline image will be periapical radiograph. The second photograph is the biplane radiograph. Biplane radiograph showing the crowns, that is the premolars and molars, crowns of the upper and lower teeth in a single radiograph. The indications for a biplane radiograph includes any interproximal caries, proximal caries, either a mesoproximal or a distal-proximal caries, any overhanging restorations, and also to see any interdental bone loss because the contact points are more open when you image a biplane radiograph. The third is an occlusal radiograph, which covers the entire arch of we have a axillary and a mandibular occlusal. To see any larger lesions, to see the extent of, say, a periapical cyst, any impacted or supernumerary, supernumerarians. And we also have the silolith detection that is done routinely in a mandibular occlusal radiograph. An occlusal radiograph also has three projections, which includes a standard or photographic section. And then we have an anterior cross-section and a lateral. So this is a schematic representation to show the composition intensifying screen, which contains a base, a reflective layer, a phosphor coat, and protective coating. So intensifying screens are used along with a cassette in an extraoral radiography for extraoral films. It basically creates an image receptor system which is more sensitive to the X-ray exposure. So what is the composition of the processing solutions? First one, we have the developer. The developer contains the main developing solution contains the main developer, which includes compounds like phenidone and hydroquinone, which are serving as the first electron donor and converts the silver ions to metallic silver. It generates the oxidized form of phenidone and provides an electron to reduce the oxidized, phenidone to the original active state. So basically, it reduces silver halide grains to metallic silver. And then we have the developer activator, which includes an alkali solution like a sodium hydroxide or a potassium hydroxide. It maintains the alkaline pH of 10 for activity of the developer. And it can also cause the gelatin to swell for rapid diffusion of the developing agents into the emulsion to reach the silver bromide crystals. Then we have a preservator which includes sodium sulfite as an antioxidant that extends the life of the developing solution. It combines with the oxidized developant to produce a compound that subsequently stains the image brown if not washed properly. So any kind of faulty radiograph, this is the most common error when your preservative is actually not washed properly. That is post developing, we have to wash the film in water bath. And then we have the restrainer, which includes bromine containing components that serves as an anti-fog agent to increase the contrast and restrains development of unexposed silver halide crystals. This tabulation shows the composition of the fixer, which includes the clearing agent, which is the ammonium thiosulfate. It dissolves unexposed silver halide ions. Acidifier and acetic acid to maintain the acidic pH of 4 to 4.5 of fixer solution. It enables good diffusion of the thiosulfate into the emulsion and silver thiosulfate complex over the emulsion. A preservative is ammonium sulfite, prevents oxidation of clearing agent, hardened aluminum sulfate. It complexes with the gelatin during the process of fixing to prevent damage to the gelatin overcooked during the film handling. So this is again a visual representation. What you see under microscopic level to show you the emulsion changes during the film processing. As we can see in figure A, so there before radiographic exposure, the silver bromide crystals, it is denoted with gray color crystals. They are present in the emulsion. And this is after exposure, the image B shows the exposed crystals containing the neutral silver atoms at the latent image site. The latent image is marked with orange dots. It constitutes the latent image. Latent image is the plain image that you see before even final rinsing and complete developing of the solution of the radiographic film. Figure C shows the developer converts the exposed crystals containing the neutral silver atoms to at the latent image sites into solid grains of metallic silver. That is denoted in the black color. And finally, the fixer will dissolve any unexposed silver bromide crystals. So only the solid metallic silver grains are present in the radiographic image. So that is how we get a proper radiographic image of diagnostic wall. So this is a representation of the dark room. So we have the dry work area and the wet work area. In the dry work area, we have the cassette, hatch, film hanger brackets, a wall-mounted lamp with safety filter, usually a frosted lamp. Safe light is used. Possibly a red light with a 15-watt frosted bulb, a workbench cabinet with storage drawer, dark room light is there. Wet work area will have the film viewing box, a wall lamp with safety filter, timer, especially when we are using the time temperature method for processing, a 4-section processing unit, writing rack, drying cabinet. So this is the safe light. This is schematic representation. So we have processing tanks where we have the developer, a water bath and building, and then we have the fixer. So this is the developing tank. So we have the insert tank for developing the fixing chemicals and with the unit power. So we have the developer, a water bath, and a fixer tank with an overflow pipe. So these are the different steps in manual processing. To replenish the solutions, stirring the solutions, mounting the films with the hanger, setting the timer for the time temperature method, developing rinsing, fixing, washing, and drying. So solutions has to be replenished at adequate intervals so that it does not cause any cross-contamination and you don't have any kind of processing errors in the final radiographic film. So this is a schematic diagram to show the automatic film processor which contains a roller film transporter. So it has a roller belt and we have the developer compartment, fixer compartment, the water compartment. So it is done automatically without any manual intervention. And we also have the replenishment pump and solutions. So the image characteristics includes radiographic density. A proper radiograph should have a proper, adequate radiographic density. So it should be able to differentiate any subtle differences. A very good contrast with high spatial resolution, radiographic speed without any noises in the film, radiographic sharpness and resolution. The spatial resolution also has to be adequate. So you get an adequate waveform image of proper diagnostic volume. So what are the different types of faults that can occur during the radiographic film processing and developing? So we have exposure and processing errors, which includes a light radiograph, dark radiograph. It can also occur because of high contrast and low contrast. Something called as film fog because of improper darkroom safe lighting, and there's an accidental light leakage or overdevelopment or contaminated solutions. Something called as orange peel appearance or a reticulation because of sudden temperature change during film processing. Blisters that can occur during the film because of extreme temperature differences. White spots, black spots in the film. When the film is contaminated with a fixer before developing and vice versa, the film is contaminated with the tank or another film during fixing. And we have yellow or brown stains because of exhausted developer or fixing solution, insufficient rinsing and contamination. Something called as dichroic fog, which appears like a pink color error in transmitted light and green color in reflected light due to insufficient rinsing after fixing, or an exhaustive fixer solution that leaves unexposed silver halide crystals in the film. A clear film not exposed or fixing of the exposed film before developing. Black film exposed completely to light. Partial image, similar to a cone cut, where the top of the film is not immersed in the developing solution. A brittle film, excessive drying temperature and excessive drying time. And then we have errors due to projection and film placement that can cause because of improper vertical angulation, like foreshortening and elongation, all these magnification errors, overlapping because of improper horizontal angulation, double image, blurred image, black lines, a heading bone or a tire track appearance. When the backside of the film with the lead foil is placed, facing towards the moon, magnification errors, distorted image. Then we have a partial image or a cone cut, which is the most common type of error that we can encounter in our routine day-to-day practice because of improper placement of the film or the position indicating device when we are going to use a paralleling angle technique. Crowns of the teeth are cut off due to improper film placement, tilted or occlusal plane. Edge of the film is not placed parallel to the incisal or occlusal surface of the teeth. Apical ends of the teeth are cut off. A phalangioma, the patient's finger or the operator is incorrectly placed in front of the film during exposure. So the cone cut is the most common type of error. This is also encountered during the bisecting angle technique because the bisecting is where the film is placed as close to the tooth surface as possible. And a preferred method will be a paralleling angle or a right angle technique. Although in paralleling angle technique also this error can happen, but it's relatively less when used with the bisecting. When used with the paralleling angle techniques, a bisecting angle technique can cause more of magnification errors. Film storage and film handling errors. We have a film fog, again a deteriorated film, something like white lines, static electricity or lightning marks or branching lines because of low humidity, improper handling, fingernail or a fingerprint mark, a crescent-shaped radiolucent fingernail mark due to improper handling and storage of the film. So these are the images to show the different types of errors under exposure. So this is a light radiograph. It can be because of underexposure or underdevelopment or excessive fixation. When the factors that is controlling the intensity of the X-ray beam, the tube voltage, the tube current, and the exposure time, and that is altered also, and it is low, we have a light radiograph. A dark radiograph is the reverse. We have a high TVP, high MA, and low exposure time, overexposure, overdevelopment, or inadequate fixation, or improper safe light or accidental exposure to light. And then we have a film fog with improper safe lighting or accidental light leakage. And then we have, diagnostic radiograph with image. So this is a good radiograph, the first one, to show you the proper density and contrast. Whereas in contrast to the first radiograph, you can see this is underdeveloped and this is overdeveloped. And this is an orange peel or the reticulated appearance. So all these can obscure the diagnostic quality. And these are developer spots that appear dark or black. Fixer spots will appear light or white. And here we have a yellow-brown film due to an exhausted developer or a fixer. When the developer is cut off, it appears as a straight white border on the film. A fixer cut off appears as a straight black border on the film. And this is an overlap film due to improper horizontal angulation. And then we have air bubbles that appear as tiny white spots that is depicted or denoted by these arrows. A fingernail artifact appears as a black crescent-shaped mark in the lower end of the radiograph. A black fingerprint artifact appears on the film. So this is again a fingerprint or a phalangeal mark. Static electricity appears as black branching lines. And these are scratches on the emulsion. It appears as thin white lines. And this is a portion of the film exposed to light, so it will appear as black. In accidental light leakage, a fog film, it will appear more of gray and it will lack proper detail, proper sharpness, resolution, and contrast. Thank you.